Good day all. This is a quick video that is going to present information that's really important for you to consider when developing a health education curriculum. This is a website from Georgetown University and the Center for Child and Human Development, and they are looking at cultural competence. So, cultural competence is the concept that you need to consider and try to integrate into your program development. There are a lot of definitions for cultural competence that all kind of center around the same things, but just different experts maybe have teased out specific things that they found to be more significant than others. But early on, Cross et al. In 1989 looked at cultural competence, breaking apart culture and competence. First focusing on culture because what is it? So culture is who someone is. It's the integrated pattern of human behavior. It includes what they think about, how they communicate, what their actions are, what their customs are, their beliefs, values, and so forth. And it also looks at who they belong to with regards to a racial group, an ethnic group, a religious group, or a social group. So culture is looking at who you are as an individual, and then when you're designing something for the public, for a specific group, who that group is, and you need to think about all of those components. The other part of cultural competence is competence, and this is making sure that you have the capacity to be competent in thinking about other cultures when developing a program. So Cross identified 5 essential elements that apply to cultural competence. And this has evolved over time, and we're going to focus on, in just a moment, health education specific cultural competence. So before we go there, Cross states that with cultural competence, you need to value diversity. So you need to value that people are different, they're coming from different backgrounds, different experiences, and so forth, and those differences impact how they might receive your information. So you'll need to think about that when developing your health education curriculum or the program. You need to have the capacity for cultural self-assessment, so being able to understand your culture and then differences with others. You need to be conscious of the dynamics that occur when cultures interact. So when two groups come together that are different, people might be uncomfortable. They might, some might be accepting, some might kind of, close up and not communicate well with others. You need to have institutionalized cultural knowledge and then also have developed adaptations to service delivery reflecting an understanding of cultural diversity. So at an organizational level, you need to have these considerations to ensure that you are providing an environment that is conducive for everybody that's part of that environment. So moving down, again, there are lots of different definitions of cultural competence. I'll point out Betancourt from 2002. Betancourt et al. Defines cultural competence, specifically in healthcare, as the ability of systems to provide care to patients with diverse values, diverse beliefs and behaviors, including tailoring the delivery to meet the patient's social, cultural, and linguistic needs. So you need to know who your population is. You need to understand, what are their values, their beliefs, what are their behaviors, and then you tailor delivery of your program to meet their needs. Going further down, we have a specific definition focused on health education, which is the focus of this course. So the American Association for Health Education says that cultural competence is the ability of an individual to understand and respect the values, attitudes, beliefs, and mores that differ across cultures, and to consider and respond appropriately to these differences when you're planning a program, implementing the program, and evaluating a health education promotion program and intervention. So you need to understand again who you're developing your program for, how they could respond to different parts of that program, and how you can best make sure that at all stages of program planning, implementation, and evaluation, you are taking that culture into consideration. And this is important because if you have something in your program that doesn't align with another culture or could be considered insulting to another culture, that can shut somebody down, and then they won't be receptive to the messages that you're trying to provide in your health education curriculum. So knowing what is appropriate behavior, knowing what is appropriate language, things like that, can help make sure that you are providing the best information in the best way so that your priority population is able to receive the information as easily as possible without any barriers set up because of cultural differences. So again, there are more definitions that go on. You can look at cultural competence for maternal and child health. There's information from a minority health perspective, and so forth. There are lots of references here for cultural competence and providing context to how these things have changed over time. And then also within this website, and again, this is the National Center for Cultural Competence at Georgetown University, there is a module series that you can look at, and it gives you good information about cultural competence. They also have information about public health in a multicultural environment. So this is really important for our area. So if you have some extra time, this isn't required for this course, but it is helpful information. You can play around on this website, look at these modules, and this can help to improve the development of your curriculum for this course and then later in your professional experiences. I will make sure this link is included in your course readings for the week. But again, play around on the website, look at how cultural competence has, the definition has changed over time. Look at what some of the modules include here to help improve your ability to provide culturally competent education. And then if you have questions, just please definitely bring them to class. You all have a wonderful day. Thank you.